In this video, let's look at the causes of constipation. So we want to look at why constipation happens, right? So constipation causes. First of all, what is constipation? So constipation, you will say, is passage of hard stools infrequently is constipation. Say, what is constipation? It's the passage of hard stools infrequently is constipation. Okay, fine. So I will pass hard stools infrequently. So what is the big deal? There you have to add. So where the patient is saying that he is straining to pass the stools. He's what? The patient is straining to pass the stools. He's having a sensation of incomplete evacuation of the bowels. He's having sensation of what? Incomplete evacuation. He's having perianal or abdominal discomfort. What is he having? He's having some discomfort. Abdominal discomfort, as you see in this image. What is he having? Abdominal discomfort. Straining while passing stools. Sensation of incomplete evacuation. So these are the complaints of the patient. So what is constipation? Passage of hard stools infrequently is constipation. Okay, now come to the causes of constipation. Now, constipation causes two types. Okay, one is gastrointestinal causes, GI causes. Then you have non-GI causes. Okay, gastrointestinal means what? Your stomach, intestine, all that. Okay, so mainly here it will be intestinal causes. So something is making the intestine hold all the stools and make it hard. So that's what we will understand by intestinal causes. Intestine. Okay, now are you ready to look at this? Okay, so what are we going to look at? The causes of constipation, two other, gastrointestinal causes and non-gastrointestinal causes. So gastrointestinal causes. So we blame the intestine here, right? So basically what is entering the intestine also they're blaming here only. Some diet is not proper. So you have to take a lot of fluids, you have to take some fiber. I don't think you should take too much of fiber, but you should take some fiber and a lot of water. That's what they are saying. But this solution may not work for everybody. So you've heard of a lot of dietary bran and the esophageal husk, etc. and the solutions to this problem. Then coming to people, the motility. Focus here, people, motility. There is no motility of the intestine. So what is happening here? There is some irritable bowel syndrome. Some drugs are causing less motility. So slow transit constipation. Intestinal pseudo obstruction. That means there's really no physical obstruction, but there is some paralysis of this intestine. So it is not moving nicely. Movement is not happening. Focus. So what will happen if it's not moving properly? What is the solution you will give? You will give some paraffin to make it more lubricative type of thing. Then you will give it some purgatives which will absorb water and bring water into the intestine, and then it will move, right? So if there's water, it will move kind of thing, right? It won't become so hard. Right, or there are some things will retain water in the intestine, right? So that also those kind of things it will do. So we will come to the treatment later. What are we looking at? We're looking at the causes. So motility over, then structural. So the intestine's structure is not proper. What is the problem with the structure? They have some carcinoma of the intestine. Oopsie. Some diverticular disease. So diverticulum, you know all that, Meckel's diverticulum. Some diverticular disease. It's not able to, the structure itself is not proper. It's not developed properly kind of a thing. Hirschsprung's disease. Have you heard of this in neonates? Hirschsprung's disease. We have studied this. Congenital megacolon. So structure problem only they're telling. No, so this makes sense, right? Some megacolon. Mega, big colon. What have we shown here? Congenital it is. So normal intestine, then there is some cone here and then constriction is there. So there is some constriction. Mega means what? So I think they're referring more to the large intestine here. So the nerves are absent. So aganglionic they are, right? So there will be intestinal obstruction. So hard stools are here. Okay. Rectal examination is showing. There's a tight sphincter. Okay. So this looks like more of a problem at the bottom. What do you say, people? In this only so much is affected, and this so much is affected, and this so much is affected, and this everything seems to be affected. Our job is to look at the causes of constipation. We are done with the structural, correct? Now let's go to the defecation. Defecation means what? Something at the bottom is the problem. Bottom is the problem. Again, Hirschsprung also is bottom problem only. here basically what is happening is anorectal disease, some Crohn's fissures are there, hemorrhoids, so painful, right? Then obstructed defecation, there's some obstruction. So basically at the end point, the exit point, some problem is there. Okay, people. So we are done with the causes of constipation. Gastrointestinal, as per Davidson textbook, these are the gastrointestinal causes. Okay, now let us go to non-gastrointestinal causes. Wake up, people. Now we are moving on to non-GI causes of constipation. Okay. Now, drugs. Again, non-GI causes, they are blaming drugs only. What are the drugs that they are blaming? Anticholinergics. This the whole world knows. Anticholinergics means what it will do? It will stop your cholinergic activity. So there is not going to be much defecation. So you are going to hold things inside. So it will cause constipation. Okay. Now let's move on. Iron supplements, you have always known iron will cause constipation. Have you ever taken iron tablets? Do you know? But why does it cause constipation, iron? I think there'll be very little water in the intestine. That's why. Something to do with the water I'm feeling. Okay, so we'll go with that iron thing. Don't forget. Okay. Then antacids, if you are taking, which are containing aluminium. So basically, if you are taking these aluminium, just look at the antacids. Okay. What? Aluminium hydroxide, I think they give. Correct? So just look at what is written on your antacid and see if it is aluminium containing. That's why you should not take too much of these antacids also. Okay. Then calcium agonist. So I'm thinking calcium is causing some constipation, just like iron. Iron, calcium, all these. Oh, but this is antagonist. Wait. So it's calcium channel blocker, I'm thinking. Correct? I think they relax the smooth muscles or something. That is why calcium also. Opiates. So who is having access to opiates? Okay, let us say you're having access to opiates. So what will happen? Constipation. Okay. Now let's move on. Neurological. Neurological means what? Nerves are the problem. Let's take a yellow here and say, okay, the nerves are the problem. You blame it on the nerves. The nerves are supplying the intestine. Like what happens in Parkinsonism? Now, Parkinsonism, dopamine is less in the brain, but okay, but what happens to the peripheral nerves? So some accumulation of something makes them rigid, tremors. So basically peripheral neuropathy, right? So they will have problem with the autonomic nervous system, let us see. So all this defecation and all problem. Multiple sclerosis, myelination is affected of the nerves. So again, constipation. Spinal cord lesions. See, spinal cord is responsible for so many things. It can either cause constipation or it can cause even for you to have incontinence also, right? Then cerebrovascular accidents. So here what is happening? The blood supply is affected, right? To what? To be the portion of the brain which is trying to control all this. So you can understand. So nerves are affected. Now let us go to metabolic endocrine causes. Now where are we? Yes, we are looking at the non-GI causes. What did we look at so far? Drugs we looked at. We looked at nerves. Now let us look at the metabolic endocrine. Endocrine. Let us use this color. Metabolic endocrine. So what happens in diabetes mellitus? Diabetes mellitus, same thing. Neuropathy, right? Hypercalcemia. See, there they blamed calcium antagonist. Here they're saying hypercalcium, more calcium. Hypothyroidism. What happens in hypothyroidism? Come on, you yourself will say. Yes, the metabolic rate is slow. The body doesn't metabolize things. It's just sleeping. Constipation. Pregnancy, what happens? Progesterone is more. And also these people could be taking iron. Constipation. Then let's go to others. We are almost at the end. People, don't worry. Any serious illness with immobility, leading especially in elderly. So you're immobile. What happens? Constipation. Yes. Depression. Be depressed, get constipation. So be happy, smile, and get rid of the constipation. Okay, people. So smile. Very good. Now you have understood the non-GI causes. Just blame nerves, blame some endocrine, systemic disorders, you blame some drugs you have taken, other causes also you add, seeing that there is immobility, depression, etc. Guys, just one more point. Okay, see, paralytic ileus, that is the paralysis of the ileum, right? Paralytic ileus, that is they're talking about the small intestine, right? So basically here, this can happen because of hypokalemia. Okay, so here they're not saying that it will cause constipation. They're saying there is fluid and gas accumulation which will lead to distension of the abdomen. So this can happen because of hypokalemia, that is low potassium, or post-operatively, etc. This can happen, or they have taken oral fluids too early after the surgery. So that can cause a paralytic ileus. But what I'm trying to say is, in this topic, paralytic ileus, because of all this, they don't say constipation will happen. They are saying more like a fluid and gas accumulation and distension of the abdomen will happen. Okay. So people, you got it right. Hypokalemia, they are not adding as a cause. Okay, so here in the causes of constipation, we have added that point here at the bottom. See here, they have not listed it as a cause, hypokalemia. Okay, we have added that in the list. You can just check more on that. Okay. Then this obstruction point is there, guys. This obstruction. So why can there be obstruction? That they didn't explain, right? Can it be tapeworm, right? Or some worms sitting in the intestine, tapeworms. Have you seen horrible photos of these tapeworms in the intestine, right? So it could be tapeworm, okay? Or it could be some other obstruction, some stricture which is causing an obstruction, or there could be some adhesion which is causing an obstruction, right? Or there's a hernia, possibly, right? So that also you should consider. People, these points you should write in the exam, right? This topic that we are discussing in this video are causes of constipation, right? Only causes. So elaborate on each of these, okay? Now, look at this table here, which is made on the side. So we just want to tell you here that if it is neonate, now think about Hirschsprung's disease. Hirschsprung's disease. If it is neonate, you can think of that. Usually, this neonates, they'll have this intussusception, etc. But in that red currant jelly, so that will be more like a diarrhea situation, red currant jelly stools, okay? So don't get confused with that. Here, they're talking only about Hirschsprung's disease, okay? Some people, like we're talking about adults now, they will really not have constipation only. They'll take laxative, okay? Then the stools will come, because the stools was already in the stage of coming out, okay? Then they'll think that they have constipation. Actually, they won't have constipation. It's more like a functional issue. You're understanding, right? They're abusing laxatives, okay? Sometimes hypervitamins, some excess vitamins can cause constipation. Obstruction, some obstruction we already told you, right? Worms, tapeworms. Adhesions can cause hernia, strictures we already told you, okay? What other obstructions? Can there be a foreign body? I'm just thinking a weird thing, okay? Then foreign body, is it? I'll put a question mark just for you to write in the exam so that you get marks. Fear of using toilet. So they might be controlling. And maybe, what happens, the more time the stools is in the intestine, it will lose the water, right? The water gets absorbed by this intestinal mucosa. So they will become a little hard, okay? So then here some more points we have written here. In old people, it can be neuropathy. Neuropathy can be because of diabetes, Parkinson's, so many types of neuropathy, right? And carcinoma also, because in old people, carcinoma chances are more, okay? So when you check these people, there can be some pelvic floor pelvic floor abnormalities can be there, okay? There can be impaired sensation, there can be prolapse of the anal prolapse, we say, is it, or rectal prolapse? What prolapse do you say? There could be some fecal impaction. Shall I put it in obstruction? Some fecal impaction can be there, right? There can be some impaired sensation, abnormal pelvic floor. Some mass may be there which is blocking. Let's say mass. Can I put a word mass here? Some mass can be there, okay? So almost all the causes we have tried to cover in this video. All causes we have tried to cover. Next we will look at how to clinically address and treatment, etc.